Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here's your host, hospice and palliative care leader and educator, Dr. Millicent Burke Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Brandon Jokum, nurse practitioner at Four Seasons. Welcome, Brandon.
Thank you. Good to be here, Millicent.
We're really glad you're here, and I would love for you to be able to share with listeners about your role at Four Seasons, because while you're in one role, you've also served in another role, and I think it would be really helpful for our community to be able to see the difference between hospice and palliative care, because you've actually worked in both, and how hospice and palliative work together. So would you be willing to share about yourself and your role?
Absolutely.
Thank you.
Yeah. So like you mentioned, I started out in hospice. This was my first full-time hospice role as an RN. And I worked in the community, in homes, in facilities, and, have done that for about 5 years, and then went to school to be a nurse practitioner during those last couple of years. And so for the last year, I've been transitioned to the palliative care nurse practitioner role. And so we serve the same communities, the home setting, skilled settings, various other settings, assisted living. But my role is a little bit different. I'm now, as a nurse practitioner, I'm now a prescriber. And, as an RN, I was doing a little bit more of like the personal care in the home. And now I'm sort of doing a lot of coordinating and educating families and patients on what kind of things to expect with their disease process. And then talking about a transition, to a hospice, to hospice when that's appropriate.
I think you make a really good point, because, individuals throughout our community struggle sometimes with being able to determine what type of care do I need when, and where do I have to be to receive certain care, or where do I have to go. I think the beauty of what we provide is we provide care wherever one calls home. And I'm going to ask you to talk a little bit about that, because since you've served in both hospice and palliative care, it makes me think that you really, truly have a heart for caring for people wherever they call home. Could you share with listeners just a little bit more about what we mean when we say that we serve individuals wherever they call home?
I mean, I think of that in two ways. I think of it in the, obviously the physical home that we call, whether that is your the actual home, or you're in an inpatient setting, or you're in a hospital, or a long-term skilled facility. And so we serve patients in all of those settings, and we serve the same patient in multiple settings sometimes, as their diseases progress. Sometimes they may end up in the hospital, and we have the ability to, coordinate with the hospital staff and help to manage them while they're acutely ill, and then see them back at the home, or if they have to go to a skilled facility, we can see them there. But I also think about wherever we call home in sort of more of like a holistic sense, with the spiritual, emotional, sort of psychological way that we feel at home. And so, in that way, and that kind of speaks, I think, to the different disciplines that we offer, especially for hospice with our chaplains, and then our social workers, which work with both hospice and palliative care. And then our music therapists, which work with our hospice patients as well. And so sometimes people have, may be in their physical home, but because of things that are going on in this other, in these other aspects, they don't feel quite settled.
Yes.
And so, if you're okay, I'd love to share just an example.
Please do that. I think that would help the listeners, because we might not often think about home outside of a dwelling, but we should feel that peace and that confidence internally as well as externally where we are. So I'd love for you to share more.
Yeah. So I had a patient who had lived in a skilled facility for quite some time, had some chronic pain management issues. And we were talking through her pain management and noticed that some of the religious iconography that she had in her room, some rosaries. And So we started talking about her spirituality, and she had identified as Catholic, but made a comment about feeling sort of spiritually isolated because the other residents in the facility were largely Baptist, and so she did not have somebody to share her experiences with. And it was actually really important because she had been raised Catholic and kind of gone away from the church for a while and was looking to reconnect to this part of herself that she hadn't been able to for quite some time. And so through our conversation, we realized that this was an opportunity to get our chaplain involved, and to coordinate with her Catholic or the Catholic priest in the area to offer that support.
That's just tremendous. And I hope that listeners see how not only do our services provide the care that one needs in like a medical standpoint, but the holistic, which is what you said. And so we can even reach out into the community to gain support and resources for what matters most to the patient and their loved ones. And it sounds like that's exactly what you're sharing.
I mean, we work a lot with our community, whether it's a chaplain in the community, or some people have, say, spiritual needs and they want to stay with their own own chaplain as they transition into hospice, and so they then become part of this patient and family's team. So there's a lot of that kind of intermixing of community and the support that we provide in our organization.
So Brandon, I really appreciate where you took the train of thought around providing care wherever one calls home. And you shared that great patient example. I wonder if you'd be able to connect with listeners about how we do the same, but for the loved ones, those family members, these most involved individuals that say, hey, you're caring for my loved one, but I have needs too. Could you share how we support?
I mean, there's a lot of support and education are two of the things I would say that we do the most. And so, the families or the caregivers, it can be a caregiver who's not even a family member, whoever that most important person is, really relies on us to help guide them through what's happening or what might happen in the future.
Yeah.
And so, that can look different depending on the role that we're in or the setting, the physical setting. But in the hospice sort of realm, we have a lot of ability to provide more 24/7 care in terms of being able to respond to their questions. If there is an acute symptom management need, we can go out to the home to see them or to the facility if they need it. And prepare them for end of life and for what to expect, and give them reassurance, empower them through training. I think now since a lot of the higher acuity medical needs are able to be done in the home, these families really need a lot of education. On how to manage it. They're kind of scared sometimes, don't really want to touch it because I don't know I don't want to screw this up. I don't know what this thing is that they have attached to them now. And so our goal is to educate them and teach them so that they can be empowered to do it on their own. We want to kind of lift them up, not do things for them in that way. We want them to feel good about being the caregiver for their loved one.
I think one thing that you shared just a moment ago was really important, of providing education on how that loved one can do what's necessary. But sometimes the caregiver or that most involved person might not be able to be there all the time. And so could you talk a little bit about how Four Seasons can either work within the organization or even with the community to help get connected to other resources? Sure.
Yeah, that's a great point. Our social worker is a huge part of that process. And we have a social worker for both our hospice and our palliative care patients. The connection to resources, like you mentioned, if I consult my social worker for a palliative care patient, because there's caregiver burden or the caregiver can't be there and they need some additional help in the home. And she's really good about being able to provide, if somebody needs to know what kind of facilities are available, we've got lists of facilities that we can give to them. If the social worker can look into community resources financially to help supplement, if money is a difficult or a barrier to getting more help in the home, caregiving agencies. Where the families can kind of call and find what the right fit is for them.
I'm glad you shared that because a couple of podcasts ago, we interviewed our director of home care, and she shared about how we can do exactly what you're saying in certain areas. And sometimes there might be needs outside of the areas where Four Seasons serves. And we want listeners to know that even if we can't provide the service of the home care service, meaning those personal needs like bathing and cooking or taking to a visit through our home care services, our social workers can connect you with others within the community who can. And so I think that's an important factor too to consider is we don't ever want the most involved person, a loved one, someone who cares, to feel like they're alone. And that's another benefit that I think about of having palliative care, is that palliative care connects you to resources that you need, whether it's internal or external. We listen to what matters and what you need and are able to provide some connection that otherwise might be really difficult to figure out.
And I think we're also, we also provide a really helpful sort of service in the facilities where sometimes it's hard to get the exact information about what's happening. And so we, whenever we see our patients, we communicate with the family, with whoever's the most important, and kind of let them know how things have been going, because a lot of what we do is preparing them for, for what this chronic disease is going to look like down the road.
I think what you just said is really important for listeners to be aware of, because I don't know if anyone's ever felt like I have before, is if you don't feel like you have the answers to something that's occurring to someone that you love, it just makes you feel really distraught or feels like you just don't know what to do. And so something that you just said, I think is really powerful for our listeners to be aware of is we connect those pieces. We bring that confidence and information together so you can have awareness, but also know you don't have to go through the journey alone. So you just mentioned another thing that's important is speaking about, as progression occurs in a disease, could you talk a little bit about how palliative care and hospice work together? Because I think oftentimes family members or even the patient themselves may feel scared or apprehensive of hospice care. And so talk just a little bit about how do we make that transition feel more comfortable, but also provide that education before it's so suddenly, if that's possible.
Sometimes it's not possible.
Exactly. Right? You're right.
Sometimes things happen quicker than we have the ability to ideally, get somebody prepared for that transition. But when there is more time, I think I am probably in a unique position to speak to that because I was on both ends of that. And I really, especially being going to palliative care, I've had a really a good perspective now on how that process often has to be built over time. I think sometimes we hope or expect as providers that people just understand where we're at. Like we understand what's happening with the disease. Like, can you get to my level so that, we can do what's best for your loved one. But it doesn't usually work that way. It does sometimes, but a lot of times people need to understand, they need to process what it means to, have a life-limiting illness, or to be thinking about a transition in anticipation of what's going to come, because there is a lot of, there can be some pushback on, well, I think, my family member is stable. And that could be true. And there may be periods of stability, but when we take a step back and we look at how this disease progresses and how it impairs their functional ability and their quality of life, there's a tipping point where a transition to hospice can sort of centralize that focus more on quality, and the risks and benefits of those same interventions that may have been available, before then, they don't feel the same anymore, right? And so, my job as a palliative care provider is to, establish where somebody's goals are, what they understand about their disease process, any medical decisions that they have made in the past, and then how that applies to where they are now. Because that's very different. A lot of people think, well, I made this decision and I don't need to, I've already taken care of that. Right. But you made that decision when you were well, or when you were not as sick. And so things change, and it's important to revisit that. And so we revisit that whenever there is a change in condition, or when we feel like or anticipate that a family member or patient is ready for that, when they give us clues that they're processing that on their own. Yes. And so when they start to transition to a place where they want to focus on their quality and they don't see the benefit in doing more aggressive interventions, right, then we talk about a transition to hospice. But it's usually not the first time we've talked about it. I usually ask that very early on to establish any myths or, right, prior bad experiences within the family that we will need to work through, because those can be pretty big barriers.
Well, and when you talk about barriers, it makes me think about sometimes individuals don't know how to go about accessing care for various reasons. So would you be willing to share with listeners how they would go about accessing our care if they are in a location similar to, say, a skilled nursing facility? And maybe talk a little bit about how that works between Four Seasons and that skilled nursing facility, or another facility outside of an actual personal dwelling.
Sure. Yeah, that process it's a little different in the facility versus in a home. Yes. In a facility, we need to have a contract with that facility in order to provide that level of care. Often if we're in that facility in a palliative care role, then there's probably or likely an opportunity to also serve them in when they transition to hospice in that facility. But it's unique to each facility. And so it's important that we, check in with to make sure that there is a contract in place, to check in with the providers and what their comfort level is in making those referrals, or any barriers that they may have to, to those services that we offer.
As you were talking, I had to get out my pen and write down 3 words. And I wonder, as listeners are processing what you just shared, if they might have some common themes in mind. As I heard you talking, I heard themes of honor, respect, and support. We want to honor wherever that patient and their loved one is in the trajectory of their diagnosis or their needs around their care. Because we truly believe that every individual needs to feel comfortable to share what's most important to them. And so we honor those that we're providing care for, but we also honor those that allow us to come in to their spaces to provide care. And that's really important for our listeners to know as well, because I think that we have lots of different listeners. And so if you say, you know what, I might be thinking that I work at a place that may have a need for a hospice or palliative provider, we want to be that partner for you. We want to be someone that your organization can look to with confidence and trust. But it also means that we have to listen to what's most important to you, as that skilled nursing leader, or as, whatever setting may be. Same is true for the patients and families. And I really like how you were journeying us through that process. And I'm going to ask, once I share 2 more things here, if you could talk about what should the patient or the family member do if they are living in a space that, for example, is not their primary, say, their home, or their personal dwelling, but instead it is in a facility or another like setting, because it is important that we honor both. And so we want to make it easy for anyone. Truly, they just have to call Four Seasons, and we can remove that burden from them. Just call us, and we'll make the connections that are necessary to make sure you have the care that you need. So honor, I think you talked about that in multiple ways. And I want our listeners to know, because every single person has needs, and we want to honor within our abilities what's important to them. Also, and similarly, respect. And so sometimes people can be a little apprehensive for us to come in to their space, again, wherever they call home. And so respect for listening to what's important, showing up at the timing that works, being present in a meaningful way that honors the space and respects the individual needs. And then lastly, support. You've talked a lot about support, but could you talk a little bit more about if someone knows that they want to learn more, they really want access, whether it's to palliative or hospice care, but they are in a facility like a skilled nursing facility, or they're in a senior community, they're in a space, and they just say, I just need to know what to do first.
Sure. So I think I'll sort of handle that from the community perspective first. If they're in the community and outside of that skilled setting, they can go like directly to our website, and they can, for palliative care, they can do a self-referral. There's a pretty easy and accessible form on the website to do that. If they can always talk to their primary care provider and ask for a referral to palliative care. A lot of providers are comfortable with that, and we have established, long-term relationships in the community. And we have people within Four Seasons whose role it specifically is to continue to, foster and enhance those relationships over time. If they're already in a facility, whether it's palliative care or hospice, we want to be mindful of that relationship with the facility and what their preferences may be in terms of that process. So, speaking to, anyone from the nursing administration, making a request and, saying this is, I would like to know more about how this program could help, could help my mom or my dad or whoever it is. Speaking to the provider themselves when they come to see them, asking them, do you think this would be something that we could bring in here to help you guys and to help me.
One of the things that I think is important for people to understand also is that as a nonprofit organization with the goal of providing the highest quality of care possible, regardless of someone's ability to pay, that means that at times we may be serving people who might be unhoused or could be living in a transitional situation, even living in someone else's space. So could you share a story about how we've served a patient in a non-traditional setting?
There are a few examples that come to mind. I've not taken care of somebody in like a homeless setting specifically, but I have helped to coordinated admission for a patient who was homeless and was sort of transitioning from motel to motel. And so meeting them where they were in that time and space. And then setting some guidelines on how that relationship was going to look without a permanent home, especially when it comes to prescribing medications. Right. That was sort of an important thing to discuss initially. But another example, and it was an interesting example because it was far outside of the community. We have patients, at least we often have patients on hospice who may have a final wish that they want, or even palliative care. But on hospice, we have the opportunity to help facilitate that if that, say that's out of state. So I had a patient early on in my hospice career who wanted to attend a football game from his alma mater. He had really advanced cancer, and there wasn't a lot of time left, and it was kind of a risky move to make. But he was really determined to do this. This was the most important thing to him. So he had the support to do it. made the arrangements, and we established a contract with a hospice organization in that area. Gave them the information that they might need in case he had any needs during that time. Unfortunately, I mean, he was able to attend the game, but unfortunately his condition escalated very quickly after that. And so he was in a motel room, not his home, not in his state, with only his caregiver there with him, no other family. And so we were able to coordinate with that organization and help manage his symptoms in that space he was in, and help him transition peacefully, and in a dignified way into his end of life.
Thank you for sharing that. I think it is important to understand that Four Seasons is an organization that genuinely respects and wants to care for everyone, regardless of one's ability to pay or regardless of one's location. As long as we serve that area, we want to serve every individual within those areas that we serve with excellence. We want to make sure that people have confidence when they think of Four Seasons and receive the services that we provide. And so it makes me think about serving individuals in their home setting. We probably all can relate to going in for doctor visits, for example, and having to get ready and get prepared and go in. And certainly that's the norm. The beauty, I think, that Four Seasons offers with palliative and hospice is there's opportunities in palliative for, say, a patient to go to one of our palliative clinics, but there's also an opportunity for us to go to where they call home. And certainly in hospice, we go to wherever they call home. So could you just talk a little bit about how serving individuals in their home setting may help to enhance their quality of life?
Sure, I would love to. I think so. First, I'm glad that you mentioned the palliative care clinic setting, because it sort of dawned on me that there are people who may have this, who may be enrolled in one of these programs or palliative care and not necessarily have the support or want the support within their own family.
That's very true.
And so this may actually be a space where they can sort of privately process what is happening to them without the pressure that they may feel from others, or be in that vulnerable space until they're ready to share with other people.
Well, I'm glad that you said that, because if anyone's listening thinking, I would be incredibly uncomfortable with someone coming into my home, that's fair. We understand that. And that's what I love about our palliative services, having palliative care clinics. So whether it's for privacy, confidentiality, like you said, or someone's comfort level. And so it's really nice that we can provide multiple settings in palliative care to be able to provide the care that they need the most.
Mm-hmm. To answer your original question about quality of life in whatever setting they're in their home setting, I think there are things that you mentioned earlier, the little things that we can do to be present.
Yes.
That's I think the first thing to think of. Silencing your phones, maintaining your presence with them, and avoiding distractions, things that would distract you. That's the first thing. But the example that comes to mind the most is patients who have dementia and who live at home. Their tolerance for changes in their environment seem to be much less than they are for other people. And so we know that, when they go to the hospital, they often end up with delirium or confusion when there's changes to their caregivers that can be really disruptive to them. They don't have the capacity to handle those changes as well as other people. And so the ability to come to them, to meet them in their space, to not have to take them out to an appointment, I think that's really beneficial for them. It gives them and the families more control over what's happening in their environment. The more routine that they can stay in, the better it is for them. So that's one example that I think of.
I appreciate you sharing that example. I remember going to see a patient one day, and I got to meet with their adult child. And when I went into the room, while this was not in their own personal setting, this was at a senior community, it was very interesting because it looked like how that grown child described their loved one, their parent, and photos from their time in New York City and with all of the things around them that really had helped to make them who they were and inspired them and what brought them joy. And one thing that I remember the adult child saying is, when we knew that we had to move from our home setting to this space because it was safer, it was the right thing for my parent, I knew that we had to make this look as close to home as possible. So having items that they relate to, whether they could remember or not. They even said, my loved one would not ever want to be seen without painted fingernails and hair brushed. And so they said, so this is something that we've asked as part of the care. Can we consider those options? And they do it for their loved one, but also wanted to make sure, like, hey, this is important. They want to still have that dignity. And you mentioned that earlier. So I just wonder, as we're coming toward a close, if you might provide an example or talk about how we do find out what's most important in that place of dignity. And certainly, palliative care would interact possibly with this differently, but especially when it's hospice care. So maybe just talk about, how do we prioritize one's dignity in care?
I mean, I think we, especially in the hospice setting or realm, we have the ability that other providers don't to focus on what is most important. And people often have a hard time answering that question. That's when true. You first ask it. It seems strange, and I think it's because most people don't ask it. And usually it's something smaller, like some smaller detail, like the way they like to dress, or a lot of older patients who are veterans are really, like, as they retire, they really get reestablished with that identity. I mean, my own father did that as well. It was not something that was really that important. And all of a sudden this like switch went off when he retired, and it was like, oh, this is who I am. Yes. And so it's really important to be attentive to those, whether they can tell you or not. Sometimes we do that through noticing pictures, hearing stories from family members, and then kind of tuning in on that and making sure we're carving out space in our interactions to honor those things that are really more important to them. Because we come in with kind of a medical scope, because that's what we do. But often the most important thing has nothing to do with anything medical, in my experience.
I think it is really transformational if listeners can hear what you just said. We connect holistic and medical in the most meaningful way by simply asking what's most important to you. We want to make sure that one's receiving excellent quality of care, but we also want to make sure their quality of life is being prioritized in whatever that looks like to them. And so I think that's really important. And what would you say would be the best recommendation you would offer if someone's listening and they say, I think I need access to care, or I think I know someone who does, but I don't know where to start?
I mean, I think, like we mentioned earlier, the website has a very easy to fill out form to specifically ask about what you want, or you might not know exactly what you need. And you may be wondering what programs are available, whether it's palliative, hospice, care navigation. And so you have the ability to sort of check all the boxes and say, can somebody just call me and talk to me about this? Like, I don't know enough. Or if they're in a facility, to talk to the staff or, the providers there and ask about that.
That's true. Yeah, I think one of the biggest things that we want our community to be aware of is we don't want any barriers to be in place to prevent you from having access to the care that you need or that your loved one needs. So you could just go to our website, or if that's not convenient for you, just call us, because we would love to provide care. We'd love to talk to you about the different opportunities for care. And we truly want to be a support for anyone in the community that has a need in the serious illness and end of life space. So Brandon, thank you so much for being with us today. And I hope that listeners are able to think about how we might be able to provide trusted care for them in their time of need. So thank you for being with us.
Yeah, thank you for having me.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.